Welcome to the EliteCare Emergency Hospital Kidney Stone Observation Unit. Thank you so much for choosing us. You are here today with severe flank or groin pain, hematuria, blood in your urine, or some other symptoms of kidney stones, and likely our CT scan has demonstrated a kidney stone and how big it is. Kidney stones affect roughly 1 in 10 men aged 40 to 50 in the United States, and there are many misconceptions about how they work and how to best treat them. Many believe that the size of the stone determines the amount of pain it will cause. But what really determines the pain threshold of a stone is its location and how far along you are with passing it. Observing the stone's movement, along with reducing pain, are our primary objectives during this time. You might think it will be easier to pass the stone by waiting at home, but without the proper equipment and diagnosis, it is impossible to determine how big the stone is and how many more hours or even days it will take to fully pass. One of the most common symptoms of a kidney stone is a small piece of a larger stone breaking off and tearing the inner lining of the kidney and urethra. If this were to happen, your pain might go away once the small piece has been passed, but this relief would only be temporary as the larger piece makes its way through the body too. One of the most important steps in treating and observing your kidney stone is establishing the pain threshold, or how badly the stone will hurt until it has passed through your body. By doing this in a clinical setting with the proper equipment, we can determine a path to recovery by administering the proper amount of pain medicine. We normally have 3 criteria to meet before going home. Pain under control. While we'll normally start with IV pain medicine, it will be important to have your pain controlled with oral pill forms of medicine before we know it's time to go home. 2. Tolerating a normal diet and liquids. 3. Ideally, the stone will pass while you're here. But in some cases, if your pain is under control and you're eating well, we can get you all set up with a strainer to continue resting at home. During your stay with us, we will provide enough medicine for returning pain, while at the same time giving plenty of IV fluids with the hope of passing the stone. Depending on the size and location of the stone, we usually have a rough estimate of how long it will take. Since we're set up as a hospital, our rooms are equipped with all the facilities of a larger hospital, and there is no upper limit to how long you can stay at our facility. At the same time, we have the personable, attentive atmosphere of a smaller emergency room. We allow flexible visiting hours so your loved ones can come whenever it's easiest for them. You can order delicious food from local restaurants, such as Denny's and Panera Bread, and our highly trained staff are always on standby to answer any questions you may have and to make you as comfortable as possible. The observation period can take anywhere from 2 to 7 days, and in that time, we will make sure you are fully recovered and ready to get back to your life without any fear of further pain. We will make sure you feel rested and cared for, so whenever you leave EliteCare, you will be ready for whatever else life has for you. EliteCare. We care because you care.